here in Chicago, Illinois. The Chicago Aesthetic Surgery Institute, which we're at currently, is in Rosemont, Illinois, which is directly by O'Hare Airport. We see a fair amount of patients for a procedure that has become quite popular called the Brazilian Butt Lift. The Brazilian Butt Lift, I think, is an amazing operation where a number of years ago I was trying to do Brazilian butt lift surgery, but actually was probably more educated in the process as the years went on through a surgeon that I worked with and currently work with, Dr. Delvecchio. He basically showed me how to sculpt the body so that we can kind of redistribute the fat that we all have and use it in a very attractive manner. And let me show you on these patients, or on this patient, what the Brazilian butt lift surgery does. You can see the ratio of the patient's waist to the hip area is actually not that great on this photo. And what you're trying to do with the Brazilian butt lift is to sculpt the fat from the waist area, trying to cinch in their waist, and using that fat to enhance the backside. When you are enhancing it maximally, I think of that as a Brazilian butt lift. And when you are enhancing it just to round out things or things that might have flattened with pregnancy, I call that a Barrington Butt Lift. Barrington is a small township known for big houses and horses in the western suburbs of Chicago, and no one's really looking for a very large backside there. But I think everybody wants to feel attractive, and I feel like the Barrington Butt Lift or the Brazilian Butt Lift is really just a change in ratios. And if you can see here what the waist looks like before the operation and what the waist looks like after the operation, that's our goal. We want to skinny this part out, and already the backside will look bigger. But instead of throwing the fat into the garbage, which we would do with liposuction, we take that fat and use it to enhance the backside. That changes the ratio of basically skinnying the waist and enlarging the hip ratio. And that, no matter how you look at this skinnier waist and slightly wider hip area is attractive to both men and women. So you're never really doing anything distasteful or perhaps overcompensating. You're really just trying to change the ratios into something that's very pleasing to the eye. And this liposuction is done all the way around. So the front of your body is sculpted in a 3D kind of technique to enhance the waist, but really almost purposely etch how your abdomen should look like. And then that fat is then also used in the mixture to enhance your backside. The surgery takes about 1.5 to 2 hours and is actually a very, very different operation than what I used to do about 4 or 5 years ago. When I go to meetings and see some of the procedures that are still being done, I feel like you really kind of have to go to somebody who actually does a fair amount of Brazilian butt lifts to get these kind of outcomes. These do not come from the standard techniques that we talk about with liposuction. This is actually a little bit more of an aggressive way to harvest your fat and purposely shape your body. You need a specific set of instruments to get through this operation safely. And having gone through the process of trying to make sure I have all the equipment over the years, I feel like we finally reached that point where all the instruments that we need to get you through this are here. But harvesting the fat is only half the process. It's really injecting the fat that needs to be done safely. And that process, when done with doctors who aren't familiar with the anatomy or perhaps don't have the right instrumentation, we really have to be careful. Always look for a board-certified plastic surgeon, and particularly someone who has experience with Brazilian butt lift surgery. If they don't have that, be very careful. I feel like there are good doctors out there who truly perhaps just don't have the right instrumentation or the right understanding of the operation to keep you safe. Without that, I think that the Brazilian butt lift surgery can be a little bit tricky. So I encourage everyone to be very safe with that. But in when you look at these outcomes, you can only be encouraged. As a board-certified plastic surgeon for a number of years, I look at the operation as a significant change in what we do. What we used to do 5, maybe 7, 8 years ago is not what we do now. The instruments that we currently use are way more safe for you, and allowing the operation to proceed very, very quickly and very safely. And the results are kind of long lasting. This is not, the ratios will not change on you immediately. If you gain a bunch of weight, sure, things can change. But the actual shape of your body, I think, will have a long lasting change and a very pleasing change. So that's Brazilian butt lift surgery. Also Barrington Butt Lift surgery if you're looking for something just a little bit less dramatic. But both are great operations, and both, again, need to be done by people who are very familiar with the operation, familiar with the anatomy, and have the right instrumentation. Be safe.